Sentara's been around for over 100 years. We have 12 major hospitals. We are the third largest employer in Virginia. We actually are a payer and a provider, so we're Sentara Healthcare plus Optima Health, and we're also involved in state and governmental health insurance. Healthcare is suffering from transparency in billing, also governmental regulations. We're seeing a decline in growth in the actual health systems. Sentara had to modernize. We have multiple hospitals all over the state that have data centers, and to consolidate that was definitely an economic savings for our health system. VMware has invested a lot in HCI. There's really no one that competes at this point. I chose it because it was a fully integrated solution. I didn't have to buy a bunch of third-party stuff. Everything is in one place. Moving to a hyper-converged and cloud infrastructure in 1 year, we've reduced by multiple millions. Sentara, since moving to an HCI environment, has had no major outages. Since we are now modernizing our EMR to hyper-converged cloud technology, taking our EMR DR to the cloud and leveraging a hybrid multi-cloud environment. Currently in healthcare, an EMR is the lifeblood of a health system at this point.
Our first and foremost effort is in keeping that uptime at 100%. Because I always try to remember that it could be my family in the hospital during a critical storm, and we don't want that outage. We were one of the first hospital systems in the country to run Epic on Horizon. We have to support 12,500 concurrent sessions at any time. That's doctors and nurses and lab techs getting in and looking at patient data. Previously, we used Citrix, and we were doing it on bare metal. It was a big pain to keep 90 plus servers the same across the board. We're starting to deal with some regulatory issues with keeping data separate. We're utilizing NSX and some cloud technologies for that. We're utilizing vSAN to scale our EMR. We can roll out another vSAN pretty quickly with some vSAN ready nodes from Dell. Having those VMware technologies just allows us to not have to worry about the day-to-day as much. We can work on innovation with all the automated tools that VMware provides. It makes it a lot easier for us.
Sentara has built a IT innovation group, and we've actually built a consultancy that we're helping other healthcare companies leverage RDSH, leverage cloud, leverage vSAN, HCI. My vision for the next 2-3 years for Sentara, and then also for our new operating company, VMware is actually a critical part of that. The hyperconverged technology, the edge compute, the SD-WAN. Sentara has allowed myself and my team to become creative and innovative and lead the healthcare frontier in technology.